Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper and the lower arch. On the panoramic view, you can see the upper right quadrant has a joint bridge, whereas the upper left quadrant has an edentulous space. Now, starting off the upper left quadrant, this is the area of the second molar. We have adequate bone quality. We've got 9.5 of bone width with approximately 10 millimeters of bone height. Here you can very clearly see that the quality of the bone is D3 to D4, as we have very little cortical plate, but this bone can definitely house a implant. Moving to the first molar region, this is the first molar region. Again, good quality bone here. We have approximately 7 millimeters of width with 8 millimeters of height, as you can see clearly here. Moving to the second premolar region, very good bone. We have approximately, there we go, 8.6 millimeters of ridge width with approximately 11 millimeters of ridge height. This is the, now we're at the canine region. Here again we have good bone, 7.6 of ridge width with 18 millimeters of ridge height. Moving to the lateral incisor region. Here now you will be able to see we have a BDR present. Now this BDR is, sorry, this is the canine. The previous was the first premolar region. This is the canine, periodontally compromised canine. We've got 7 millimeters of ridge width with approximately 15 millimeters of height. This is a periodontally compromised canine, so if it is extracted, immediate implant can definitely be placed. Moving to the lateral incisor. Again, lateral incisor has no cortical plate, a very big periapical radiolucency. We've got approximately 5 millimeters of ridge width with approximately 40 millimeters of height, but this is all below the regular anatomy. This is going to be approximately 8 millimeters below the crest of the existing ridge. Moving to the central incisor region, central incisor has periodontally compromised. We've got approximately 6 millimeters of bone width with 20 millimeters of height in this region. This is the central incisor of the upper right quadrant. Very periodontally compromised, perforations in the cortical plate, approximately 7 millimeters of width with 20 of height. But again, the bone quality in this region is compromised due to the periapical infection. The lateral incisor has a post, and that post is also fractured beyond the tooth structure, a periapical radiolucency and perforations in the cortical plate. So lateral incisor has very poor bone quality. The canine also has poor bone quality because of very severe bone loss around the tooth structure. But the ridge width in this region is 6 millimeters of width with 15 millimeters of height. The premolars are very compromised with severe bone loss. The second premolar region, we've got approximately 8 millimeters of width with 15 millimeters of height. The first molar has excellent bone quality. This is below the cantilever, 8 millimeters of width with 15 millimeters of height. And the second molar has very slight bone because of the height, as pneumatization of the sinus has occurred. 11 millimeters of height with just 8 millimeters, 11 millimeters of width with 8 millimeters of height. So very intense. We've shown you the bone dimensions of each and every tooth in this region. We'll also place implants based on where we believe is the most ideal place. If you have any further questions after that, please feel free to reach to our team.